Good morning and welcome to everybody to my session on benzodiazepines. These are the very commonly used drugs in anesthesiology. Benzodiazepines are sedative and hypnotic drugs that can be used for anxiolysis, sedation, and induction of anesthesia. Overview. Benzodiazepines are widely used preoperative, intraoperative, and postoperative medications. An overview of this class of drugs will be provided here. For more information on specific drugs, you have to approach the appendix on drug information. Now, mechanism of action. Benzodiazepines bind to the specific receptor sites on the alpha subunits of the gamma amino butyric acid, that is GABA receptors. Finding of benzodiazepines enhance the affinity of the receptor for GABA. This causes increased chloride conductance and hyperpolarizes the postsynaptic neurons, resulting in inhibition of synaptic transmission. Structure-activity relationship. Chemical structure is a benzene ring fused to a 7-member diazepine ring. Hence the name benzodiazepines. Representative medications include the midazolam, lorazepam, alprazolam, diazepam, oxazepam. Now pharmacokinetics. Absorption, rapidly absorbed from the gastrointestinal tract with oral dose. Rapidly enter the CNS and other highly perfused organs with IV injection. Distribution, highly lipid soluble, highly protein bound to albumin. Disease states that cause the hypoalbuminemia, that is cirrhosis, malnutrition, chronic renal failure, result in increased proportion of unbound drug and lower dosage required to achieve the desired effect. The metabolism. Drugs with active metabolites include diazepam, midazolam, metabolized by the hepatic microsomal enzymes. Drugs without active metabolites include lorazepam, oxazepam. These are metabolized by glucuronidation only. Special considerations. Benzodiazepines decrease the cerebral metabolic oxygen requirement, that is CMRO2, and cerebral blood flow. Unlike barbiturates and propofol, Midazolam treatment does not result in an isoelectric EEG. May cause anterograde amnesia, decreased ability to acquire new information. Clinical uses. Preoperative anxiolysis, especially for pediatric patients, anticonvulsants, sedation for procedures or critical care, alcohol detoxification, skeletal muscle relaxation, that is spinal cord mediated, not effective for surgical relaxation, treatment of acute insomnia, adverse effects or toxicity, dependence, fatigue, drowsiness, decreased ventilation, dose dependent, most pronounced in patients with chronic pulmonary disease and in conjunction with other respiratory depressants. Potentiates the sedative effects of other medications, especially opiates. Decrease in systemic vascular resistance with large doses. May inhibit the platelet aggregation, that is, this is caused by midazolam. Treatment of toxicity. Flumazenil is a specific benzodiazepine antagonist. It reverses the benzodiazepine effects, including ventilatory depression. Titrate the drug for the individual with an initial dose of 4 to 20 microgram per kilogram IV. And additional doses of 0.1 milligram given at 1 minute interval up to 1 mg. Typically, effective doses are 0.3 to 0.6 milligram. Duration of action is 30 to 60 minutes. May need to be repeated depending on the duration of action of the benzodiazepines administered. Alternatively, an infusion of 0.1 to 0.4 milligram per hour can be used. May precipitate withdrawal seizures in patients on anti-epileptic medications. May increase the intracranial pressure in head-injured patients. Now we come to the summary of benzodiazepines. Definition. Benzodiazepines are sedative and hypnotic drugs with a common chemical structure of a benzene ring fused to a 7-membered diazepine ring. Mechanism of action. Bind to the sites on the alpha subunit of the GABA receptor, increasing the affinity of receptor for GABA, resulting in inhibition of synaptic transmission. Uses. used for sedation, anxiolysis, and induction of anesthesia. Treatment of toxicity. Benzodiazepine overdose can be treated with flumazenil, a specific benzodiazepine antagonist agent. Thank you. We come to the end of this session.